Good. Hi, everybody. Welcome to our second webinar session. We are very excited to welcome our guest speaker today. I'm just going to read a little biography about her to give her some credit about all the hard work that she's done and the knowledge she has. So I'd like to welcome Prabjeet Barn. She is, and bear with me, a knowledge translation specialist with legacy for Airway Health, which is an initiative aimed at improving prevention and care for asthma and COPD. So she fits into today's subject matter really well. In her role, she works with patients and community partners, as well as researchers, healthcare providers, and policymakers to help provide or move evidence into practice and policy. So she takes the knowledge she discovers and puts it to practice, which we love. She previously worked as an environmental health and knowledge translation specialist at the BC Centre for Disease Control, where she helped to support evidence-based environmental health practice and policy in BC and in Canada. She holds a PhD in health sciences from Simon Fraser University and a Master's of Science in Environmental and Occupational Health from the University of British Columbia. So everybody, please welcome our guest speaker for today. And I'll hand it over to you.
Thanks, Lindsay, so much for that introduction. And I just want to start off with an apology because this webinar was supposed to happen 2 weeks ago, but unfortunately I fell ill, so we had to reschedule. So thank you for your patience, and thanks for having me here today. I'm really happy to be here and to talk to you about wildfire smoke. I just also wanted to give a shout out. I just quickly scan through the attendees, and there's a familiar face, Dan. Hi, Dan. Dan is part of our community of our patient advisory committee at Legacy. So just wanted to say a quick hi to him. So today we're going to be talking about wildfire smoke events. So first, just talking a little bit about what they are. What are the common health effects, and especially for people with respiratory conditions, and then we'll move into what you can do protect yourself and things you can consider doing ahead of fire season as well as throughout. And then we should have plenty of time for questions. So what are wildfire smoke events? It's basically when smoke from fires, either near or far, travel into your community and deteriorate the air quality. Unfortunately, fire smoke is not going away anytime soon. Just with the changing climate, we're seeing in BC as well as worldwide that the frequency and the intensity of wildfires are increasing. So this is something, it's our new reality that we do have to think about. Forest fire, or these wildfire smoke events, can last really up to just a few hours to days to weeks, and it's really dependent on the situation of the fire and how well contained it is, as well as meteorological conditions such as wind patterns. So there might be a fire that's close to you, and if you're downwind, you might be getting a lot of that smoke being blown into the community. And then if the wind patterns change very quickly, you may not be exposed anymore. So it's really dependent on a number of things. The smoke itself is a complex mixture of several different pollutants, and some of these are gases like carbon monoxide or volatile organic compounds. But the one that we're really concerned with is a pollutant called fine particulate matter, and it's an important component of wildfire smoke, and it's also known to cause or to be particularly harmful to health. So I wanted to focus on that and what it is. So particulate matter is basically solid or liquid particles that are suspended in the air, and they are very, very small, so you cannot see them with just you can't just see them looking into the air. You really need to look at them under a microscope. So just to give you a sense of how small they are, this is a piece of or a strand of human hair under a microscope. And just from the diameter of this human hair, you can fit about 5 PM10 particles. So PM10 particles are size 10 micrometers in diameter or less. And within each of these PM10 is this fine particulate matter, the pollutant of concern, PM2.5. So these are particles that are 2.5 micrometers in diameter or less. And so you can see a lot of them several of them can fit across a strand of human hair. So it just gives you an idea of how small they are. And the size of them, as well as the composition of the particles, really impacts how you're affected health-wise. And even more important than what the particles contain is, again, back to the size, and that's why I really wanted to spend some time talking about it. So the smaller the particles are, the smaller they can, when they're breathed in, the lower within the respiratory tract they can go. So the larger particles, or if you think about dust or something, it really starts to irritate you in your nasal passages, and we have a lot of systems there, like the mucus and the cilia, that can help to trap some of those larger particles. But the smaller particles aren't trapped easily, and they can breathe down deeper into the respiratory tract, where they can really irritate the area linings. And these PM2.5 particles, because they're so small, they can actually be transported across the lungs and into the bloodstream, where they can enter or they can be transported to other parts of the body and impact other body systems as well. Just when we talk about PM2.5, the way that we measure them is as mass per unit volume. So this is a very common concentration or a unit that you'll see, so micrograms per meter cube, just if you're wondering what that is. So there's lots of different ways to understand and get information on the levels in your community. And I'll talk about each of these. So one way is through the air quality monitoring network that's set up across the province. Another way is through the Air Quality Health Index, which is connected also to this Air Quality Monitoring Network, and that's the HEPA, which we'll get about. And then there's also alerts and advisories, which are special kind of information that's put out when there's a very important event happening. So just to talk first about the air pollution monitoring that happens in the province. This is a screenshot that I've taken from the Government of BC website. And this information is accessible to anybody. And after this presentation, you'll be given a bunch of links, including the one to this webpage as well, in case you want to follow up for this information yourself. If you go to the website, you can see this map of BC, and each of these dots indicates the presence of an air quality monitoring station. And at each of these stations, there's a combination of different pollutants that are measured. So at some stations, PM2.5, PM10, there's also ozone, nitrogen dioxide, sulfur dioxide, and then there's also an AQHI reading that's available for each of these. The way that the monitors are set up, it's really meant to help us understand the distribution of pollution across BC and really where people are being impacted. So you'll see that the greatest density of monitoring is in the Lower Mainland, and that's just reflective of where a lot of people live. So if you go to this website, you can look at, you can go flip through these different tabs. So here I've highlighted PM2.5. So the colors are actually linked to the concentration. You can see in most of these places, I took this just a little while ago, the concentrations are relatively low, so between 0 to 5 or 5 to 15 micrograms per meter cubed, and these are 1 hour averages. And then when you get into the more red colors, those are the higher concentrations. And this information is always there for you to access. So that's one way to understand what the smoke levels are in your community. The other way is to look at the Air Quality Health Index. So again,
sorry, can I just interrupt? Some of the attendees are having a hard time hearing you.
Okay.
Yeah, they're saying it's a little echoey or it's a wee bit muffled. If I can just make you be loud, okay. Like me, perhaps. Sorry to interrupt.
Okay, no, thanks for letting me know. You
yeah,
know what?
Of course.
I'm using a different headset. I have a more heavy-duty one, so let me just switch to that. It just means I have to stop sharing. And
okay.
Just give me 1 second.
Sorry, thank you. I appreciate that. She means business now.
Yes.
Good.
Is that better?
Yes.
Yeah, is that, yeah, that's much better. Okay, good. Thank you for letting me know.
Oh, of course. Thank you.
Yeah, I try to avoid wearing this one if I can. It's just, yeah, as you said, very heavy duty. All right. Um, okay, so then to the AQHI. So just going back to this page, you can see there's a tab for the AQHI, and if you click on that, you'll see the same map, and then the circles will be reflective of the ratings for the AQHI for each of these stations. So you'll get the map form. There's also an option to see the information in a table form, which is right here at the bottom of this page. So here you can actually scroll down for each of the communities that the AQHI is available for, and you can see the current AQHI number, the rating, and then you can also see what it is for the rest of the day. And then there's also a forecast for the following 36 hours. So it's a prediction of what is expected, what the AQHI rating is expected for the nighttime, for the next day, as well as for the following evening. And the way that the Air Quality Health Index is calculated, it's a combination of the concentrations for three pollutants. So one being PM 2.5, which we talked about. The other is ozone, and the last one is nitrogen dioxide. And the AQHI year-round is available for 14 communities across BC. So again, if you go to this site, you can see all of those 14 communities there. And this represents about greater than 80% of the population. So again, the monitoring is really set up to try to capture pollution
What the risk
concentrations where people
qualification
are
will be.
exposed. So each of these ratings are linked to specific health messages. So you can see up here in this this horizontal bar that goes across. Any rating between 1 and 3 is considered low risk. Between 4 and 6, it's moderate. Between 7 and 8, it's considered high risk. And then anything above that is considered to be very high risk. So what does that mean? So if you go into what these numbers mean and what these ratings mean, you'll get this information here. So there's health messages linked to each one of these, and they're divided into two populations. One is the at-risk population, and this is considered to be people with respiratory or heart conditions. And then there's the general population. So, and then all of the advice is really geared towards helping to advise you on what to do regarding your outdoor activities when there's depending on the AQHI rating. So if there's a low rating, so anything between 1 and 3, as somebody from an at-risk population, the advice is that generally the air quality is quite good. So enjoy your usual outdoor activities. There's not really any concern. As you start to move into the moderate or high, the advice changes. So if you're in the high rating, anything between 7 and 10, the advice is really, if you come from this higher risk population, please consider reducing or rescheduling strenuous activities. And in particular, children and people of older age should consider just taking it easy if they're outside. If we get into the very high ratings, which we have, depending on where in the province you're from and when, it's the languages or the advice is a bit stronger. Just really avoid strenuous activities, and really, if you're even more vulnerable, so if you are elderly or if you are, have children, really try to avoid outdoor physical exertion. So this gives you some sort of sense of what is the air quality and what should I be doing about it. And there's lots of different ways that you can sorry. So one way is the air quality monitoring, the second is the AQHI, and then the third is to understand alerts and advisories for your community. So I'm not sure how many of you are aware, but you can actually sign up to get alerts via email and or text on your phone, depending on where you live, or it's available for all of BC. If you live in the Lower Mainland, the alerts will come not from the government of BC, but from Metro Vancouver, which is because they issue their own advisories. So you can sign up for these advisories in your area, and if there is an air quality advisory, you'll get a notification right away. You can also sign up with the same subscription service for something called Smoky Skies Bulletins, for, again, for your area. And the Smoky Skies Bulletin is really intended to notify you quickly if it's expected that there will be a smoke event or high levels of smoke within your community in the next 24 to 48 hours. So the information that's used to generate these bulletins or these alerts for the Smoky Skies is the PM 2.5 concentrations from the Air Quality Monitoring Network. And then it uses additional information from satellites as well as from smoke forecasting models and also weather data like wind patterns to really understand, is there a concern for some communities that might be heavily blanketed by smoke in the next 24 to 48 hours. And then I just also wanted to mention part of this alert system is there's a special service just for Kitimat because of the industry there, that if there is high concentrations of sulfur dioxide, which is a different pollutant, you can also get alerts for that. Maybe I'll just stop there just because that is quite a bit of information to see if anybody has any questions. And if not, we can continue.
Prajeet, it's up to you if you want to answer questions now, or I'm just keeping track of questions that are in the chat that you can
Okay,
address
that's
at the
great.
end. Whatever you prefer is up to you.
Okay, no, that's fine. That's
Okay.
great that you're keeping track of that.
Mhm.
All right, so moving on to the health effects. So there's a lot of research being done to help us understand what are the health effects of wildfire smoke. Um, and unfortunately, because now more and more communities are being impacted, it is creating a situation where we can start to better understand what the health effects are. So research shows us that there are a lot of known or suspected if impacts of wildfire smoke. So asthma and COPD exacerbations occur during wildfire smoke events. We see this reflected in how much people are getting kind of rescue medication inhalers and how much they're using these medications. We also see this in doctor visits and increased ER emergency room visits. Bronchitis and pneumonia are also connected or linked with exposure to wildfire smoke. All cause mortality, which means that just generally a greater number of people are passing away during and following a wildfire smoke event. There's cardiovascular outcomes. So again, we see increased emergency room visits for heart conditions, for stroke and things like that. And there's more and more evidence also showing that there's adverse birth outcomes related to wildfire smoke exposure. So this means that if somebody is pregnant or and exposed to wildfire smoke, that there's some evidence now showing that they may have babies that are lower in birth weight, or they may have babies that are born earlier, or what we call preterm, because of their exposure. Little is known about the long-term impacts of or wildfire smoke exposure, just because, as you know, the exposure isn't continuous throughout the year. It's really sporadic, and it's unpredictable in a lot of cases. But again, because now we're seeing more and more communities being impacted, and a lot of times the same communities, where there is more and more research trying to really investigate what are the long-term impacts of this repeated wildfire exposure. So who is considered to be most vulnerable? So people with respiratory conditions, as we talked about. Again, going back to the AQHI for that health messaging, it's really the at-risk population, and the advice there is really geared towards people with respiratory and heart conditions, as well as older adults and children, pregnant women, as we just talked about, and there's also more newer evidence showing that people with other conditions like metabolic conditions like diabetes might also be impacted. So we're finding that PM 2.5 is really can really affect the way that people their insulin levels as well. So I imagine that over the years we'll just keep adding to this list of vulnerable people as we start to understand more and more the impacts of wildfire smoke. So I just wanted to obviously focus on people with respiratory conditions, just talking to all of you today. So I'm sure a lot of you have had experience with wildfire smoke and understand how it's impacting you. So some common symptoms include difficulty breathing. So this might be decreased ability to breathe in as deep as long as you normally can, coughing, increased phlegm production, chest discomfort or tightness, wheezing, and shortness of breath. And generally, what you can expect is whatever your baseline symptoms or just general symptoms are, smoke will generally make those symptoms worse. There's lots of different ways that you can protect yourself, and these are things that all of us should be considering before the wildfire season as well as throughout, just to better protect ourselves. So we'll go through each of these pieces of advice. And again, this is recommended ahead of as well as during every wildfire season by different public health organizations and agencies. So the first one is to talk to your healthcare provider, to find clean air, whether that's through clean air shelters in the community or creating kind of cleaner shelters at home. And again, we'll talk about what each of those mean. What's really important is with some wildfire smoke comes heat, and it's really important to also understand what your heat exposure is and to manage that as well, because aside from the smoke, heat can cause also a lot of different impacts on your body, and it's really important to be aware of that. And when possible in a smoke event, avoid being outdoors. If you can't, we will also talk about this advice around wearing a mask. So the first piece of advice is to talk to your healthcare provider. And it's really important when you can, before the wildfire season starts, is to talk to your healthcare provider to really try to understand how might you be affected by smoke and what can you do about it. So how will it affect your regular course of management, and what else can you do? So if you talk to your healthcare provider and you understand that maybe during smoke wildfires, during a smoke event, you might need some rescue medications, it's really important to understand that beforehand, to actually have that rescue medication sitting at home ready to be used, and that you know how to use it properly, if it's not a medication that you use regularly. Just so that if there is a smoke event and you're finding it's impacting you and you're like, I would really need to use this rescue medication, that you're not trying to book an appointment with your physician to get an appointment or to get a prescription, or trying to run out to a pharmacy during these heavy smoke levels, just to make sure that you have it ready to go at home. And again, that you feel comfortable knowing how to use it properly. A big piece of advice, that the idea of accessing clean air is really centered around this idea of staying indoors. And this is really because just kind of common sense, generally less of what is outdoors makes its way indoors. And just being indoors itself and doing nothing else does provide a level of protection that can really benefit us. But what that level of protection is will really depend on what your indoor environment is and what type of building or home that you're in. So this is just a simplified diagram of all the different ways or things that can impact how much protection is provided. So this is just a simple picture of a house. Over here, we have outdoor air pollution, which is just shown in these large gray circles. We know that air pollution does not look like this, especially those fine particles are very, very small. But just for the purposes of this, you can see that through this open window, you have this outdoor air pollution that's making its way indoors. So that's kind of easy to understand. If you have a window that's open or if you have a door that's open, that outdoor air is going to come inside, and along with it, that outdoor air pollution. But another important thing to think about is the building envelope itself. So if you have these windows and doors and you have gaps in the envelope, that's another way that outdoor air pollution is going to make its way indoors. If you have air conditioning, if it's central air conditioning, or if you have these portable units, depending on how the air conditioning unit is set up, if you're just circulating indoor air, you're not pulling more air from outdoors, you have a higher level of protection compared to not having an air cleaner unit or having, drawing in more air from outdoors. And then indoor air pollution is really important. So how much air pollution are you actually generating indoors that's contributing to the air pollution that's coming from outdoors? So we'll talk about each of these things. There's been a lot of research to try to understand how much of that outdoor air pollution comes indoors. And the term that we use in the research is infiltration. So that's really getting at how much of that outdoor air pollution is coming indoors and staying suspended. So if we're thinking of those particles, or how much of those particles are coming in and staying in the air or being resuspended if they settle on like table surfaces or carpets or something like that. And a lot of the research shows that these things, these factors are really associated with lower infiltration. So what the winter season, having central air conditioning, having double glazed windows, newer homes, and air cleaner use. And these all are really linked to lower air exchange. So if it's the winter season, that's kind of intuitive. You tend to not open your windows as much, so you have less air exchange, so less of what's outdoors is coming indoors. If you have central air conditioning, again, you have less of the outdoor air coming indoors, depending on how the unit is being used. Also, with a lot of these air conditioners, there is a filter in place, so it's actually drawing air through the filter before it's coming indoors and you're breathing it in. Double glazed windows tend to be very tight, so you have less of that gap around the envelope, so you have less of that air coming in. Newer homes tend to be tighter, more energy efficient, which again means less of what's inside is going outdoors and less what is outdoors is coming indoors. And then air cleaner use is also associated with lower air exchange because if you're using them properly, you're really trying to limit the outdoor air from coming indoors so that the air cleaner can do its job and clean the air that's already inside. What you're doing indoors again really matters. So if you are staying indoors as a way to protect yourself from smoke, it's really important to think about um, limiting the amount of pollution that you're creating indoors. So in generally, it's really a good idea to avoid having anybody smoking indoors, and especially during these smoke events when we're already worried about air pollution. Some types of cooking can generate a lot of pollution, including particulate matter. So things like frying or baking, it can create a lot of heat indoors. So if you're, if there's heavy smoke levels outside and it's hot, maybe try to avoid certain types of cooking and baking indoors when you're trying to stay cool and protect yourself indoors. Lighting candles, opening windows, these are kind of intuitive things that you can do to reduce air pollution being generated indoors. And generally, just make sure if you're staying indoors is to make sure that the space that you're in is as clean as possible. So the way that we can do this is really look for clean air shelters in the community or create clean shelters at home. So the first one we'll look at is clean air shelters in the community. So these are basically just large air conditioned spaces that you can readily access. And the idea is that if they're large spaces with air conditioning, they're going to be drawing air in from outdoors through this filter and the air conditioner that's going to be cleaner compared to outdoors. And because if it is a large space, it's also going to help dilute some of that pollution. So you can bring in some of that air pollution from outdoors. Some of it will be filtered, and what is not will be diluted in this kind of large amount of air indoors. Um, if it's air conditioned, it'll help you keep cool, which again is another very important factor to think about during smoke events. And some examples of clean air shelters are shopping malls and libraries. So if you're able to access these, it's good again ahead of a fire season to really identify some of these potential clean air shelters in your community and see if it is accessible for you. So in theory, this is great. In practice, again, it's really important to first identify is one available near you? Are you able to access it quickly as needed? And how long can you stay there? So um, just something to think about if there is a shopping mall in your area, but you need to take two buses to get there and you have to wait outside for a bus stop, and those smoke levels are really high, maybe you need to consider, is it better just to stay indoors at home versus trying to venture out? Or if you're like, I don't have an air conditioner in my home, it's predicted that this smoke event won't last too long. It won't last past tomorrow. And right now it's really hot, and I think it is worth venturing out because I can stay at this shopping mall for a couple hours in kind of the height of this, hot period of the day. Then maybe it's worth it. But that's just something to kind of consider prepare ahead of the fire season to have a kind of a plan in mind, and then also think about feasibly how long can I stay there. And then the other option, or in addition to that, is to consider how you can clean and the air in your home and create a clean air shelter at home. So there's two ways to do that. One is using portable air cleaners, and the other way is to look at the induct filters within your building, your home's heating and cooling system. So we'll talk about each of these. So sorry, and I just wanted to draw your attention to this. So this is an example of a portable air cleaner. So they're just basically standalone units that you plug in and that you can easily pick up and move around. And then this is an example of an induct filter, which again is part of the home's heating and cooling system. So there's lots of different types of portable air cleaners. I've listed 3 of them here. So there's HEPA filter air cleaners, and HEPA stands for high efficiency particulate air. There's electronic precipitators, and there's ozone generators. And I've listed ozone generators here, and I wanted to just draw your attention here in red and really highlight that these are not recommended for residential settings. They are available, but they really should not be used because the way that they work is they actually generate a pollutant, ozone, and this ozone gets released into the air. And the idea is that the ozone will actually chemically react with pollutants in the air, things, other gases like volatile organic compounds, and help to neutralize and clean the air this way. But in residential settings, it's not a good idea to release more pollution into the air, especially if you are already at higher risk. And if you have a respiratory condition, ozone is a respiratory irritant. So Health Canada strongly advises against using ozone generators. So I just wanted to talk today about HEPA filter air cleaners and electronic precipitators. So HEPA filters use mechanical filtration, which means it's a filter that's very high efficiency. And in a unit, when there's a HEPA filter, the unit comes with a motor that basically draws air into the unit. It draws it across the filter so that all of those small, even the very small particles get captured on the filter, and then it expels clean air. And then, and these HEPA filters are very high efficiency. So they capture about 99.97% of those very small particles that we talked about. And then electronic precipitators work a little bit differently. So within a unit, they have 2 oppositely charged electronic plates, so positive charge and negative charge. They draw air in using a motor into the unit, and depending on the charge of the particles, they get captured on those electronic plates, and then the clean air is expelled. There's a lot of research out there that shows that the use of these portable cleaners, and specifically HEPA filter air cleaners, is quite beneficial when you have an outdoor air pollution source. So there's some studies that have looked at the use of these HEPA filter air cleaners during wildfire smoke events in homes. And then there's also other studies that have set the air cleaners up when there's an obvious outdoor air pollution source, like homes that are near major roadways or in places where you have a lot of outdoor air pollution like coal combustion. This is a graph that I just wanted to give you a sense of the benefit of these air cleaners when they're used properly. So this is actually a table from my master's research that I conducted many years ago, back in 2004, 2005. My project looked at wildfire smoke as well as residential wood smoke infiltration into homes in BC. So what I did for 2 summers and 2 winters was or for the summer portion, was basically just sitting in Vancouver waiting for a big fire. And when there was one, just driving up with all my equipment to a community that was nearby, that wasn't in physical danger of the fire, but that was being impacted by the smoke, and basically just knocking on doors and asking, could I set up air quality monitoring equipment inside and outside your home, as well as an air cleaner, and just measure what's happening. So this is a graph from one of those homes in the summertime. And the light gray line here is showing indoor PM 2.5 concentrations, and the black line is showing outdoor PM 2.5 concentrations. And for most of these homes, we sampled for 48 hours, and half of that time we ran the air cleaner without the filter. So the air cleaner wasn't really doing any cleaning. And for half the time, we ran the air cleaner with the filter. So that's when the air was being cleaned. And we looked at the data, and this is a really nice piece of data that we got that really shows the benefit of these air cleaners. So the light gray line here is showing the indoor concentrations, and the dark line, as I said, shows the outdoor concentrations. And this for here on this side of this black line, we can see that the air cleaner was run with no HEPA filter. So that's not doing anything, it's just running. And you can see that the indoor concentrations are really tracking what's happening outdoors. So when you see an increase in concentration outdoors, you're really seeing the same concentration increase or the same pattern indoors. And this is quite remarkable. And again, going back to this idea of staying indoors really does provide a level of protection, but the amount of protection is really dependent on the characteristics of the building or the home that you're in, as well as behavior. This over here is an example of an indoor peak. So something was happening here where all of a sudden the indoor concentration shot up, and it's not related to the outdoor concentration. So something here was happening. So again, to also think about what you're doing indoors that might be contributing to the pollution levels. And then over here, after this, at this point, we ran the air cleaner with the HEPA filter in place. And this is what we saw. We saw that the outdoor concentrations were going up even higher than the period without the HEPA filter, but the indoor concentrations are consistently lower, and you don't see that same pattern. You see this pattern of like when the outdoor concentrations are going up, you're seeing the indoor concentrations going up, but it's much more dampened, that effect of the outdoor air pollution. So there really is a benefit to using these air cleaners if you're being impacted. And it's really important to make sure that you're using the air cleaners as effectively as possible. So the main piece of advice or main thing to really consider when you're looking at portable air cleaners is to make sure that the unit that you're using is actually designed to clean the amount of air in the room that you're intending to use it in. So if you have a big space that's quite open and there's lots of air in that space and you're using a small unit, it's not going to be as effective because it's not able to draw in air quickly enough to actually clean it. And it's just drawing, it's just not going to be effective. So most of these units on the box, it will actually give you a number of like, what is the maximum room size that this air cleaner should be used in. So that's something really to pay attention to. And it's important to use the air cleaner in the room that you think you're going to be spending most of the time, just because it provides the most benefit there. And we want to make sure, especially when levels are really high, that you're getting as much benefit from these air cleaners as possible. Use them continuously, if possible, throughout the smoke event. And linked to that is try to find quiet models if you can. A lot of these models, especially the newer ones, tend to be very quiet, but some of them really advertise how quiet they are, or they may have special modes for sleep or for nighttime where the motor is even more quiet. And this is really linked to using them as much as possible if you have them. So if you're finding that the air cleaner is noisy, you're like, yeah, I know they're really beneficial to use, but I cannot sleep with it on, and you turn it off, it's not giving you the benefit that you could get. So if you do tend to be a little bit more sensitive to noise, try to find one that's really advertised as being a quiet model. Replace the filters as needed. Most of these units do come with an indicator where there will be an indicator light that says that the filter needs to be replaced soon. You can generally go through a few if you're only using them during the fire season, especially, you can go through a few wildfire seasons without having to replace them. But again, it's really important to keep on top of replacing them as needed. And again, if you're staying indoors, make sure you manage your exposure to heat as much as you can, whether that's leaving the house when you need to access a air conditioned space, or getting a portable air cleaner unit or air conditioner if you don't have one. The other type of air filters are the induct filters. So again, these are part of your buildings or your home's heating and cooling system. So this includes the forced air system or heat pump. A lot of these systems already have air filters in place. They just may not be high efficiency or HEPA filters. HEPA filters, because they're so tight, they require a lot of air. They require a lot of energy to blow air through. So most systems don't tend to have HEPA filters, but they do have other high efficiency filters, which provide a lot of benefit that during the wildfire season, particularly. So something to consider is to talk to your service provider and see if you what to understand what the efficiency of that filter is and whether or not you can just upgrade to a slightly higher efficiency, and if your system can handle that. For some systems this might be a very easy switch, and for others it just may not be possible or it may be costly. So those are just things to think about again ahead of a fire season. And then the other things to think about is how frequently is the system running, because the air is only being filtered when the system is actually running and when that air is being pushed across the filter. And then, as with portable air cleaners, make sure that the filters are being replaced or cleaned as needed. So moving on to the next piece of advice, during a smoke event, when it's possible, avoid going outdoors. So a lot of this is kind of just trusting yourself and thinking or trying to understand how the smoke might be impacting you. So really intuitively, if you can see and smell the smoke, don't go outdoors if you don't need to. If it seems to be affecting your breathing, you understand yourself and your condition and what makes it worse better than anybody. So if you feel like the smoke levels are affecting your breathing, try to avoid going outdoors. Um, Try to be aware of any air quality advisories in your community. And again, you can sign up for the air quality alerts so that the information comes to you and you don't need to go seeking it out. Look at the AQHI, the Air Quality Health Index readings, and follow the advice that's listed there for that rating. Um, yeah. And then when it's not possible to avoid going outdoors, the last kind of piece of advice or the last layer of protection is really the use of masks. So again, if you can't avoid being outdoors, consider wearing a mask. I have a picture here of it's a screenshot from a document from the BC Centre for Disease Control. And again, you will have a link to this resource as well after this presentation. And this document basically summarizes everything that I'm going to say here. So again, if you can't avoid being outdoors, consider wearing a mask during a smoke event. And the best mask is really the most efficient one. So these tend to be the ones rated as N95, KN95, or KF94. And on this photo from this document, you can see that the masks clearly marked with this rating. I know that at some point of the pandemic, it was really difficult to get any masks, let alone high efficiency masks, but that's changed over time. So a lot of times you can find these in stores like London Drugs or Canadian Tire, as well as online. There's a lot of local manufacturers, local to BC as well as Canada. So really trying to buy them from a trusted source. If you cannot find them in a pinch, a three-layered cloth mask is a good alternative. So definitely not the one-layered cloth mask, just because they don't do much to stop those very small particles, but a three-layered mask can be an alternative. What's really important is the fit. So it's really important to make sure that the mask actually fits your face well. If you have large gaps on the sides, it's really not doing much because all of that air is getting in and you're breathing it in. So fit is really important. And then also to make sure that you're wearing it properly. So I know sometimes they're maybe not the most comfortable to wear, especially when it's hot. So if it's not covering your nose, if it's not covering your mouth, again, it's not providing the protection that it could be. What's really important when if you do wear a mask is to make sure you wear them outdoors and you don't wear them inside while you're sleeping, especially just because it will affect your breathing, or it could potentially affect your breathing. That you are able to breathe comfortably, especially in the summertime when it's hot outside, the smoke might already be affecting your breathing, just to make sure that the mask is comfortable to wear, it's well fitted, and that you're able to breathe as comfortably as possible. So those are the main public health recommendations that are made. There's a lot of information out there. There's a lot of different sources of different sources that you can go to kind of prepare yourself before the wildfire season as well as during. So the main one to really start off with is to talk to your healthcare provider. And again, before the wildfire season is ideal, just so you can understand how you might be impacted, to understand how exposure to smoke might impact your treatment or your management plan, and also to understand if you need any rescue medications on hand. And then there's lots of trusted sources. So I've listed here the BC Lung Foundation, of course, the BC Centre for Disease Control, and your local health authority. So these are really great places to go to first before kind of Googling or looking for other sources, because there is a lot of information that takes time to kind of go through, and these are really great sources of trusted information. So here I've just taken a screenshot from the BC Lung Foundation website on their wildfire smoke and health page, and down here each of these links to different documents that are produced or developed by the BC Centre for Disease Control. So there's a resource on health effects of wildfire smoke, how to prepare yourself for the wildfire smoke season, the Air Quality Health Index. And again, these are really great sources of information that have kind of gone through all the research and all the evidence and the best advice, and really give it to you in a short, easy to read format. That's again a great resource to kind of look into. So that's my presentation for today. I'm really happy to take any questions that any of you have.
Wonderful. Thank you so much. I learned so much from this already, so it was great. Thank you. There were a few questions that were sent in early to Maureen, and then just a few that popped up in the chat box. If anybody has any additional questions that came up, please just put them in the chat box, and then I'll read them out to Prabjeet or Alexa will. So Alexa, you've got the list of questions as well. I think I'll just start it off. Some of the early questions, the first one was, I have central air in my home, as well as a special filter to clean the air being circulated. Is there anything else I can do to protect myself from the smoke, as she has COPD? So any specific recommendations? Yeah.
So, I mean, that's great. I'm really happy to hear that. And it sounds like you're doing kind of what you need to be doing in terms of making sure that indoor air is clean, that, you know, that air coming from outside is being filtered. So that's great. The other things to keep in mind is, again, your exposure to heat, just to make sure that's managed, making sure that there's no important sources of air pollution that's being created indoors. And then also when you go outdoors, just to make sure that you are aware of what the smoke levels are if you do need to go outdoors. And yeah, consider wearing a mask if you need to. And yeah, those are the main things I would say.
I think that's good.
Great. Next question that was sent in earlier. I shut myself inside with my air purifier and fan, but wonder if there is any way of finding out which air cleaners work best.
Yes, I would go back to what we talked about. So the HEPA filter air cleaners and the electronic precipitators. Going back to the research, a lot of the research has really focused on these HEPA filter air cleaners. They are quite common. Most stores that carry air cleaners will have HEPA filter air cleaners, and they might have some additional technology with it. They are getting more and more complicated in their packaging, and that might just be more about marketing, but just to make sure that they have that HEPA filter in there. And then again, to make sure that the unit is designed to clean the amount of air in the room that you're using it in. So again, it might be a HEPA filter, but if it's being used in a very big room that the motor is just not strong enough to draw the air in fast enough, it's not going to be as effective. So to make sure that it's properly sized for the room.
I'm just going to skip a question and actually tag into those air purifiers. There was a question about ion generators as an air cleaner. Is that like an ozone generator?
Yeah, they're similar. So with they're also similar to electronic precipitators. So with the electronic precipitator, as I mentioned, they contain charged plates that draw air in, and then they capture the particles on the plates themselves, and they expel the clean air. With ion generators, similar to ozone generators, they actually release charged particles or charged ions into the air. And the idea is the same, is that they um, they get attracted to the particles in the air, and they help to settle them onto surfaces so that they're not in the air, and then they're not free to be breathed in. But again, it's just releasing more things into the air. And just because these particles are being settled, it doesn't mean that they can't be re-entrained into the air if you're walking around, or if these particles are on carpets and you're walking around, they can go back, they can get back into the air where they can be breathed in. So really, HEPA filters, the advice is to look at HEPA filters or electronic precipitators where the pollution is actually contained within the device.
Okay, yeah. Does that make sense to everyone? That the filter kind of traps the particle better than just letting it kind of settle down like a dust and then kicking it back up in the air potentially? Yeah. Okay.
Great. I'll just continue on with the questions. The next question that we got was, which mask to wear that will protect the airways from inhaling PM 2.5 from wood fire smoke into the lungs?
Great. So, I mean, two things there. Going back to that slide about mass, really the high efficiency, so the N95 or the KN95 or the KN94. So anything with that rating, they're the most efficient. So they're going to do the best job in terms of keeping those small particles, the PM 2.5 out. The other thing with that is fit. It's really important that they fit well as possible. I myself, if I need to wear an N95 mask, I wear the kid size because I have a smaller face and I find they fit a lot better. As of the adult ones, there's a lot more gaps. So just to think about the size of that. And then I think in that message or in that question, it talked about wood burning. So maybe that's related to like wood stoves and residential wood burning. So the composition of wood smoke from residential wood burning is slightly different from the composition of smoke pollutants in the smoke from wildfires, but an important component of that is PM 2.5. So the same masks are important for wildfire smoke or for residential wood smoke. It's really that key pollutant is PM 2.5.
Just to add on, and this is a question for myself, but when should a mask be discarded? Should we be wearing it repeatedly, X number of hours? If it gets, our exhaled breath is moist. So if it gets wet, should we discard of it? And kind of what guidelines would you provide for that?
Yeah, that's really a good question. A lot of these masks are meant to be single use. So that's something to keep in mind. And for sure, keeping them dry is important. So if it's really hot outside and you're breathing and you're saying they're getting quite warm, to consider going indoors for a period of time and giving your face, and your lungs a little bit of a break, and getting that mask a little bit drier is helpful. But yeah, a lot of these masks do tend to be single use.
Good. Okay, so I think there were a few questions associated with that mask regarding the PM 2.5 particulate.
Yep.
So I think we pretty much answered those. There was one that just asked, and I believe you went through it, but how do you sign up for that air quality advice?
So after this, everybody will get an email with some links. So the links will be to the air quality monitoring network that I showed you. So that map of BC and all of those stations where you can look at your PM 2.5 concentrations, the AQHI, as well as all of the other pollutants. And then there's also a link in there for signing up to these air quality alerts. So again, when you click into that, it'll ask you for which community. So it'll give you a list of communities that it's available for. So you can select the community, and then you can choose to have it sent via email, the alert sent via email or text or both. And if you live in the Lower Mainland, that same link will actually redirect you to Metro Vancouver, where the option isn't for text, it's only for email, but it will give you those alerts.
Perfect. All
Um,
right. That was the end of the questions that I had, Alexa.
There's one more that just got put into the chat box, but I'm not sure if this is something that we can speak to, but maybe Maureen.
No, Maureen said to just leave that one for now.
Okay.
She gets a few questions on the Facebook group, and so she said she'll address it later.
Okay.
Yeah. Anybody else in the group have any questions that might have popped up?
I do. Hi, thank you so much for everything. So I'm being a broken record, I know. I have a respirator, you know, the kind with the two little things with
The filters that you've got the mask like this and the filters
I
on
hope
the
I've
side.
got the right one, seriously, because I'm so sensitive. Like when we got the new car, I couldn't be in the new car without wearing it.
Yeah.
The outdoor wood burning smoke, like
Yeah.
we've got air blowers at our entrances to blow the air away from our door.
Yeah.
A purifier in every room. So does it work? You know, like the mask with the two.
Yeah, the elastomeric mask is what it's
Yeah.
called, and it's the halfway face one. I'll answer really quickly from us, and then Prabjit, you can add to it. We wear those in the hospital.
Okay.
We do. We wear them whenever there's airborne infections. And so the filters, they're filtering the air that you inhale. And then there's like a one-way valve that filters out. Now we are fit in the hospital to make sure we get a really tight seal.
Yeah.
I'm not certain where you bought yours. Generally, you hope that it
Home
like
Depot.
Prabjit said, yeah. Oh, okay. It should be pretty snug. Did they?
Yeah.
And there's a way to ensure that you have an effective seal. So if you breathe in and you squeeze your filters, it should kind of pull the mask into your
Yeah.
face. And if you cover the front of it where you exhale out, it should kind of lift off your face, but not separate that seal. And
Yeah.
remember, those filters are only good for, I believe, 1 year. You should, replace
Okay,
them.
thank you.
Yeah, unless you're using them quite frequently. So if you're
Okay.
wearing it every day and the filter's getting used daily for quite some time, then I would recommend looking into replacing it more frequently.
Okay.
But I'll let Prabjit add into that.
No, that's great. Thank you.
Yeah.
What do you think
Yeah.
about that study out of McGill University on the 10%? The long-term study on people living within 50 kilometers of wildfire smoke?
Oh, was that the cancer
The brain
risk?
cancer and lung cancer, yeah, increase of 10%. I thought it was going to be higher. I hate to be an optimist, but I thought it was going to be worse than 10%.
Yeah, thanks for bringing that up. So I saw that study is out. I haven't had a chance to actually look into it. But it's an important piece of emerging evidence. Again, there's not too much evidence that's looked at long-term health impacts. So what happens to communities or people that are repeatedly exposed, maybe every wildfire season. So I think it's really important to look at what new information is coming out. But I think we'll need to wait for more evidence and just to see how people are being impacted before we can really definitively say what's
There's 2
happening.
million people in the study.
Yeah. So
Yeah,
it's
large
making use
study.
of all of the people in this large area.
Yeah.
Willa, did you read it?
I skimmed it
You skimmed
because
it?
my heart just starts to,
Yeah.
sorry, I just sort of like, it's like some of the news. So no, I don't know all the details,
Okay.
but I enough, the 2 million people, so a good sample.
Yeah.
You know, they left out over 95, they left out the younger.
Yeah. And did they, I'm just curious because, wildfire smoke is one thing, but, family history, I'm curious if they
Exactly.
looked
Did
into
they
that,
isolate
right?
that?
Yeah.
No, I don't know the details on that. You're absolutely right.
Yeah.
I
Not
know,
to say
I
that,
know.
yeah,
I know, because look at all the risk factors you presented.
yeah,
Yeah, absolutely.
for sure. But that's interesting. And that came out of McGill this year?
Yeah, McGill University.
Okay, I'll take a look for it.
Yeah, I think it was just published in the last week.
Okay.
Yeah. What I was gonna say was that
It was a 20-year period, sorry.
Oh, okay.
Yeah, I just wanted to just kind of, I just caught something that you said that reading that article was very overwhelming or a little bit scary. And I think what's really important to keep in mind is that unfortunately this is our world. We are, we have this changing climate we're seeing just in the last few years. We are getting more fires, and BC especially is really being impacted by these climate related events. But saying that, there are a lot of things that we can do, and a lot of these are practical things that we can do to
Mhm.
really protect ourselves. So it can
Right.
become very overwhelming, and um, I think it's really just good to put our energy towards when we can, just trying to think
Mhm.
about how we can uh, protect ourselves the best we can. And whether that's, getting masks when we're going outside and we feel like are comfortable to wear and are giving us good protection, getting air cleaners in our homes, talking to our doctors, our healthcare providers to figure out, is my treatment plan going to be any different if I'm being exposed to smoke for 3 days. So there are a lot of things that we can do. And I think maybe if we can focus on that, it helps empower us a little bit, and it takes away some of the anxiety that I think all of us are feeling for sure, especially like there's layers to this. There's climate change. We're seeing increased smoke events. There's flooding in BC. We're still in a pandemic. All of it can become quite overwhelming. But I think with all of these things, there's a lot of things that we're learning. There's a lot of information we're sharing. There's a lot of places we can go for information. So if we can just focus on that, I think that's really helpful.
Thanks, Willa. Janet had a question about wearing a mask at a campfire. And I just, did you want to elaborate on that, Janet, or just curious
Not
about
really. I
just
plan
what
to,
kind of mask?
yeah, I'm planning to be camping.
Yep.
And we'll have campfires every night, probably, weather permitting. So shall I wear my mask?
The good question. I would say bring it, have it ready to go, make sure it fits you well. When you're sitting at the campfire, try to sit, upwind of the smoke.
Right.
And that can change, but like if you need to, like just move around so you're not getting that heavy smoke directed in your face. And if you feel like it's affecting you, then yes, go ahead and wear your mask. But I think again, if you're outdoors, if you're not very close to the fire, it's an enjoyable experience. Try to be upwind of the smoke, see how it's impacting you. Kind of go back to um, thinking of like trying to be in tune with how it's affecting you. If it is affecting your breathing, you're like, feels a bit irritating, but I still want to sit here, then put on your mask, or, go for a walk, come back a little bit later. But just, yeah, have the mask ready to go for sure.
Thank you.
Any other questions from the group? You can unmute yourself. Yeah, Dan, go ahead, unmute yourself and ask away.
Just a short question. People that are on oxygen, if you're having trouble with the air and it's harder to breathe, do not just turn up the oxygen. Contact your service provider before you do that. I had the experience of turning it up, and you will be an emergency. So you just maybe crack it up just a little bit, talk to your provider, and they'll give you the guidance. Okay.
Yeah, that's a really good point, Dan. If you're on oxygen and you feel like your breathing is getting harder and you feel the need to turn up your oxygen, that's a short term just to get you through, but you should be contacting your physician, or if it's extreme, then get into emergency, because something's changing with how your lungs are working. Maybe you're sick or something. So we want to see you and actually address what the problem is instead of just giving you the oxygen.
Also, you can use your rescue inhaler too to kind of get you by. So your Ventolin or anything like that to really help if you're having shortness of breath or anything like that. So reach for your inhaler to kind of help you, especially if you have that action plan that'll kind of help let you know, step it up and then get yourself into Emerge or your local care provider.
Yeah, and then going back to just making sure you, sorry,
Yeah.
Dan.
The action plan usually does not address this.
No, but it
respiratory.
might prevent, if you have that steroid to take, it may prevent worsening of the inflammation that maybe is contributing to it. And we can get ahead of it before it becomes a big problem. Yeah. Sorry, Prabjeet, we're gonna add.
Yeah, I was just gonna say, kind of just adding to what Alexa said. So just making sure you have that rescue medication on hand, that you feel comfortable using it.
Mhm. For sure. Anyone else? Doreen, is that a you're all done?
I'm
Yeah.
not done. Thank you.
Wonderful. Well, it is 3:05. I think we've exceeded impeding on Prabjeet's time. So I really want to say thank you so much for this. I found it extremely valuable. Hopefully it's information we don't have to use, but it's great that we have this information to use it. So just remember, our next webinar is July 22nd. We do have another guest speaker that will be attending. Alexa, remind me the topic name.
So we have Alana Sims coming in, and she's going to be doing exercise for your lung health. So she's a physiotherapist, and you may recognize her through BC Lung. She has done talks in the past, and she's on our Better Breathers program or Facebook page. And she's going to talk about exercising with COPD and asthma.
Good.
Or just exercising. I don't
And
do any of that.
keeping
so
lung,
I'll
health,
learn.
lung healthy.
Wonderful. Thank you everyone for coming today. We'll see you in a bit.
Sandra.
Thank you.
Everyone.
Thank you.
Bye.
Bye.